So the idea of the session is to actually have a diagnosis on the current state of the patient-clinician relationship. So what is maybe already good, or what is there and what could be improved. And then move on from the state of diagnosis to treatment, to see what is needed in times of disruptive healthcare system all over the world, as it seems, to improve the patient-clinician relationship, and maybe have some tools from the health and information technologies and the modern sciences out there to help improve this core relationship. The main interest here is that as a researcher, doing a lot of research on patient engagement, patient activation and motivation, I learned that if you do reports or surveys or quantitative methodologies on patients, you kind of get an idea what patients are up for, what their problems are, what the needs are. But in the end, if you really talk to actual patients, you get humble and realize that they actually most often have different needs or other needs than what medicine addresses. So medicine is able to address what they know and what can be operationalized, but they're not so good in addressing what the patients actually want. And they have their own language, they have their own mindset of what they want. For example, they want to be happy. And medicine is not up to make people happy. So they need a diagnosis, they need some treatment, they need some kind of what fits into the medical setting. So my idea is we really need to ask the patients what their needs are. And engaging patients certainly is not about having patients follow medical guidelines, but really tell their stories. So we need to incorporate their stories. So patients and clinicians and doctors really need to talk to each other. And I'm keen on helping this happen. Since I'm studying happiness as one of my topics, I have to say the thing that would make me happy at first is to acknowledge that we are all in one boat. We're all up to the same thing. That is actually happiness. If you're a physician, or if you're a clinician, or if you're a nurse, or if you're a patient, in the end, you want to live your own life as happy as possible. So what would make me happy is to form a community as the first thing, of people who are realizing that you cannot solve the problems in your own profession, not on your own. You need the other people. So the first is have a community coming out of this, of people who are really addressing the same goals, the same ideas. The second would be if we would have let's say 3 or 4 quite specific, concrete suggestions how, and that would maybe work because we have enough people here who know how to make things happen and how they would work, to really get the patients into the room and to learn from them. And maybe we set a spark to have this become a continuing discussion. Maybe some research coming out of how transparency, as one tool, for example, could make a difference, could engage patients. Maybe some really good design for research showing that this would lead, for example, to better medicine. There's a lot of work to be done, but if some concrete ideas for research or practical ideas would come out of here, I would be very happy.